In this video, I'd like to continue with the theme of medication non-adherence and look at one of the most important causes of non-adherence, namely cost-related medication non-adherence. You'll see here that I've divided this talk into three categories. We're going to look at the problem first, and then look at the population at risk, and then I'll end with some practical tips on how we can help our patients. So let's start with the problem itself. Some studies have shown that cost-related medication non-adherence is actually one of the most common causes for non-adherence. One study actually put this at number 1. It seems to be an important barrier. In one survey, 57% of people reported that this was a barrier to adherence, and in a study on primary non-adherence, it was in the top 3 causes for people never going to the pharmacy to fill even their first script. In another study, which was done with focus group interviews to try and determine why patients with primary adherence were not adherent, one of the top 3 recommendations from this group was that doctors and healthcare workers should be more sensitive to medication cost, and in particular to the cost of the co-payments, which is often a big barrier in terms of remaining adherent on treatment. I'd like to move on now and talk about the population that would be at risk. And if we look at that, there are a number of groups that are more prone to this challenge. And studies have shown that people from low income groups, that's not a surprise, and patients with no or limited insurance, medical or health insurance, are certainly at risk. Also, patients who have multiple chronic diseases, especially if there are 3 or more, the elderly, the disabled, people with depression, all of these are at much higher risk of having cost-related medication non-adherence. But also, just remember that there are other factors such as really expensive medication and high co-payments associated with the medication. Let's look at some practical tips that you can give your patients. So targeted assistance programs have been tested, and what they've done is to look at combining a number of different things and looking at which of these the patient would qualify for. And in one such study, they looked at 621 Medicare beneficiaries, and they looked at each one's insurance plans, checked whether they would qualify for patient assistance plans, for government subsidies, or for less costly medication alternatives. And in this study, they were able, for these 621 patients, to realize savings of $770,000 US. So these are, whether it's part of a targeted assistance program or not, these are things to consider. Remember that even in patients with insurance plans, cost-related medication non-adherence is still common. One Medicare study showed that up to 30% of patients with insurance had cost-related medication non-adherence. A second important one is to look at the insurance formulary. So this is very important because if you are not prescribing medication on the formulary, there may be serious co-payments. And there are now some e-prescribing programs with formulary decision support, which will actually tell you for this particular patient which medications have no co-pays, low or high co-pays. So that could be very useful to implement in your practice. In patients that have stable chronic diseases, one can consider reducing the frequency of their visits. Sometimes one gets into the routine of saying come back every month or every 3 months, but it may actually be possible to make it less than that. And one mustn't forget the indirect costs of a day away from work, lost income, etc. One should also not forget about clinical trials. Clinical trials offer medication for free, plus usually gives compensation for coming to hospital and for out-of-pocket expenses on the day. So that is a very useful way of helping patients get access to very expensive medication while not incurring any additional costs. There are some novel approaches these days with reward programs where patients can generate points which they can spend on certain online malls that may actually reward them for being adherent. I must say there are actually programs where people get financial incentives for being adherent, which have been shown to be more cost effective because of the cost saving of getting better results on treatment. But that is not practical in many places. Lastly, one can consider financial assistance. So there are some pharmacies, some governments, and some other healthcare or health insurance institutions that may offer financial assistance or loans to patients, which they can use if this is a big challenge. So, in summary, cost consciousness and sensitivity to the fact that patients may have a problem in terms of affordability of drugs is very important for the doctor. Look out for the population at risk and try to tailor your intervention to the individual patient as far as you can.